Committee will come to order. Thank you.
Thank you. I'm Betsy McCoy, former Lieutenant Governor of New York State, a
patient
advocate and chairman of the Committee to Reduce Infection Deaths. I've spent a good deal of my career in infection prevention in hospitals, and I admire many of the achievements of the VA in that area. But I'm here today to express my concern that this bill passed in the Senate yesterday, the McCain-Sanders bill, will not save the lives of vets stuck on the wait list. This bill, as currently written, is designed to protect union jobs, not ailing vets. In fact, the VA is run largely by unions and for unions. And one of the culprits is this 316-page union contract full of mind-numbing rules that prevent assigning an employee to a new task, a new work shift, a new building, or reprimanding someone on the staff for misdeeds or just poor performance. 9 months ago, the VA rolled out a $9.3 billion initiative to allow vets who were stuck on wait lists to access civilian care. But the unions fought it as hard as they could. The American Federation of Government Employees labeled it in their newsletter, The Worker, an attempt to dismantle the VA brick by brick. That's not true, but they vilified it that way. And this current bill sabotages the ability of vets to access civilian care in 3 ways. First of all, it requires, and I'm referring to Section 301 starting on page 21, since I'm sure you'll be reading the bill, it requires that any vet wanting to access civilian care get a letter from the Secretary of the VA confirming that the vet has waited an unacceptable amount of time for treatment or lives more than 40 miles from a VA medical center. Good luck getting that letter. I talk to vets all the time who have contacted the VA, called them, emailed them every day for 6 months and couldn't get a reply. Secondly, if a VA does manage to get the letter and get the choice card and get to a civilian doctor, then he has to hand the card to the doctor who is instructed to call the VA and get prior approval before treatment. Good luck getting somebody to answer that phone call. And thirdly, most preposterously, this bill states that this choice program will end in 2 years. In other words, a few hours after the VA manages to get the hotline up and get the cards distributed to vets, it will be over. So there is a way to solve this problem and put the vets in the driver's seat. And I'm going to credit the RAND researchers with this idea, because the fact is that almost half of vets stuck in these waiting lists are seniors. They're 65 or older, and they're virtually all on Medicare. If they were encouraged to seek non-combat related care, age-related care such as bypass surgery, angioplasty, at civilian hospitals, particularly teaching hospitals, it would reduce the backlog by as much as half, solving this national crisis. And in many cases, vets would get better care because the mortality rates at the teaching hospitals associated with many of these VA medical centers are much lower. They're high-volume hospitals, and they do these age-related procedures all the time. What's holding the seniors back is lack of knowledge about that resource, and secondly, the co-payments, the out-of-pocket expenses. We could give those vets who are already on Medicare a special VA Medigap card. It's budget neutral. You're already paying for the care. And yet it would allow them to access better care, it would reduce the wait list, and it would allow vets who have fought for our freedom, it would allow them the freedom to get the care they need. Thank you for this opportunity.
One of my concerns is, and I would ask on a comparison, this is to you, Dr. McCoy, you carried around this. This is the collective bargaining agreement between St. Mary's Hospital, the Mayo Clinic, and their health care providers. It doesn't make as good a theater as a big one, but it's still there. I would make the argument that the Mayo Clinic delivers good quality health care. Your assertion is that it's totally based on the collective bargaining of the people there. I don't believe in any way moves this argument forward. So my question to you is, when was the last time you personally were in a VA hospital? And tell me about your experience there as you talk to the providers and talk to those nurses at the nursing station.
Well, I actually just talked to some of the people at the VA hospital here in D.C. a few minutes ago, and let me explain that they are, right, I haven't been to their hospital yet, but I have talked to them. And let me explain that they are also concerned about the mismanagement or misallocation of staff resources. It's so bad, for example, that at some of the VAs, and I know you'll probably confirm this, the physician has to spend a lot of time going out to the waiting room, getting the patient, explaining how to disrobe, doing a lot of things that in another hospital or clinic would be by ancillary staff, so that doctors can see not 2 patients an hour or 3, but maybe 6. Some of this is a problem with union rules, and to say that it isn't is just preposterous. I haven't read their agreement, but to say that unions are not part of this problem is just read the American Federation of Government. Just let me finish. You asked me to come here.
You answer.
Now, that is not true. In a democracy, we both get to talk.
Mr. Chairman, I'll yield back my time.
Time has expired. Dr. McCoy.
Yes. One of the problems is really quite simple, and it's been pointed out in many of the reports that have been submitted to Congress over the last decade, including the one that was presented on Monday and the one that was presented by the General Accountability Office in March of 2013. And that is that vets are assigned an appointment, and then months go by and nobody calls them to remind them a day or 2 before the appointment that they're supposed to come. That is a practice that is always done in private sector medicine. Every doctor's office, every clinic, every hospital calls patients and reminds them to show up for their appointment. The result of this failure is that in some departments like ophthalmology, according to the GAO report submitted last March, the no-show rate is 45%. So when you say you don't have enough appointments and enough doctors, almost half of them are going to waste. And yet why, every year, does another report have to remind the VA to call the patients and nothing is done about it?
Doctor?
Yes, I'd like to point out 2 things. One is that, as I mentioned in my opening statement, in the 90s, the VA really took an admirable lead in patient safety, and particularly in prevention of nosocomial or hospital-acquired infections. Lately, we've seen less and less of this. Dr. Jane, who has now taken a bigger job at the VA, has done some wonderful work in the prevention of methicillin-resistant Staphylococcus aureus. But in general, that pioneering effort to protect patient safety that I saw in the 90s has disappeared somewhat from the culture. That, and as I pointed out before, how can you have a focus on the patient when you have 316 pages of rules about what employees can and cannot do just from one union, just from one? This contract governs the work rules for 200,000 people who work at the VA, and it is preventing a focus on the patient.
VA shortcomings and failed benchmarks was the result of inadequate funding or management of resources. Mr. McLean.
I personally don't think it was the result of inadequate funding. The VA budget has really increased significantly in the past 5 or 6 years, but I think pretty obviously it's a misallocation of those resources.
Mr. Caller.
Not only a misallocation, but perhaps just looking the other way when you have the resources. I think I heard on Monday night the fact, Chairman Miller, that you raised a specific financial number that's been invested or been provided for IT and IT-related services, and the question was raised, where's the money? And so whether it's a misallocation or just perhaps an ignoring of those funds available perhaps leads to the current state.
Dr. McCoy.
Yes. The VA budget has increased 173% from the year 2000 through 2012. That in inflation-adjusted terms is 72%. The increase in total VA patients was 69%, so the funding increased at a faster pace than the number of patients who had to be treated. And the number of acute care patients who need costly care increased only 49%. So the VA funding should have been adequate to meet the increased demands on the system.
Tell me about how the system that you're advocating here today.
Yes.
And then, Mr. Collar, I'd like you to also reflect on it. So tell me how.
So this is a simple proposal. As I pointed out, about almost half of the vets using the VA are on Medicare. They're 65 and older. They're virtually all covered by Medicare. But the out-of-pocket expenses under Medicare are too much for many of them. And so they continue to get care at the VA, even when they have an age-related problem, like they need a bypass surgery. And there's a teaching hospital down the street where they could be getting the care, but they're worried about not so much the inpatient deductible, but the outpatient deductibles and copays. And so if we gave them a Medigap card just for vets, a special red, white, and blue one, to pick up those out-of-pocket expenses, then they would have the choice of going to another type of hospital for that care. If you look at the outcomes measures, particularly for these age-related procedures, with the exception of just a couple of the VA hospitals, other teaching hospitals are producing better survival rates. So we'd get a twofer. We'd get the care for the vet. It's budget neutral because it's all coming out of federal dollars, and they would have a better chance of surviving their procedure.
Mr. Collar.
Succinctly as possible, what's the greatest single barrier that exists out there today within the VA to providing timely health care?
And I'm going to go off on what Mr. Collard said is standardization. You've all heard it. If you've seen one VA, you've seen one VA. And there is too much, flexibility or variability in how services are delivered and how veterans can access services at each of the VA facilities.
When you standardize your practice, you create greater predictability in outcomes. Whether it's an attorney, a finance expert, a healthcare expert, they'd all agree that when you standardize your mode of practice, you create greater predictability in outcomes. And it's the outcomes that I think ultimately this panel has to be able to address, and not just the process of care measures that we're talking about.
Thank you. Dr. McCoy?
Yes, I'd like you to focus on the failings of this bill, because pretty soon you're going to be voting on it or compromising with the vote you took in the House to create a final bill. And that final bill that you create has to remove these practical impediments. Otherwise, you are not passing a bill to give vets access to civilian care. It will be a charade if they have to get a letter from the secretary and if there has to be a call made to get prior approval for the treatment. Just remember that, please, as you compromise with the Senate.